So hello guys and welcome back to my channel Guide to Glory. So as you might have seen in the title that you can get unlimited pizza for free in surgery clinical posting. Is it real or was it just a clickbait? You will just get to know in just a few minutes. So we have along with us Mr. Hem Prajapati. So he will tell us about his experience of his surgical clinical posting during his second year and how his entire group was able to manage an entire party of unlimited pizza and I guess even a lot more in his 1 month of surgery clinical posting. So Hem, please tell us your experience about your surgery clinical posting.
Hello guys, myself I am Prajapati, and yeah, I'm going to tell my surgery clinical posting experience today. So, in the posting, the experience is not only about the study and learning because it is the posting. It's not the lecture that it may be one way or two way and that's done. Posting is like communication with the faculties, with the members, with the residents, with your colleagues. And in the surgery, the most important thing is you will be with your colleagues and surgery residents whole day, or might you will be with them the whole day or maybe more. Like you have posting only for 3 hours. So like 3 घंटे की posting हो गई, then you are done. It's not like that. There will be OT, then any extra class also. कि resident अगर सुबह में free नहीं है, then they will be taking their class at afternoon or maybe 5 to 6 also beyond the college hours. So like it's not only about the posting. They will also tell to go to NCOT. So you can go to the emergency wards as a NCOT in between the posting at night. So surgery posting is not only about the learning, it's about the hospital experience. And the surgery posting was my one of the favorite posting in the second year. And it's only not only about the experience that you did, it's about learning in that experience in between them, that how to work in the uh, hospital perspective and how to do a rest of the works over there. It's about that. So initially on the first day, sir told that you will not only going to learn here only, you will be learning in NCOT, in the operation theater and everywhere. So on the first day in the posting, we were there and sir told us that yeah, you are learning this topics. On first day, obviously on every posting in the second year, they will be asking you, yeah, history लिखनी आती है? अगर नहीं आती है, then they will explain that how to write history and everything. And then from the second day, they will start with the topics of the surgery and they will go ahead and proceed further.
Okay, so that was the thing. But how you build such a rapport that you were able to get an entire party of unlimited pizza? So how did that happen?
Actually, my basically interest was in the surgery field, so I just attend every OT and everything. And not only me, my whole batch was also supportive, and we all attend the operation. We almost attend more than 10 OTs in the posting. We build a great rapport with the residents, and we attend every lecture. And not only one way lecture, we like communicating, asking doubt, asking the residents to take a lecture of the surgery. We all were interested in the lectures. So होता क्या कि हम जाते हैं सुबह and the lecture हो जाता है, then we also go in the afternoon कि sir OT कब है, sir when we have to come, and the residents were also happy with us. और फिर कहीं बहुत सारे लोग रोज NCOT में जाते, तो we were like with them whole day, some of the person of the batch. So पूरा दिन उनके साथ रहे, they were saying oh ये तो like हमारे साथ है. And there was a farewell party of one of the resident and he said नहीं अब तो ये पूरा महीना हमारे साथ रहे, and they were great, having great support and everything. So we will call all of them for a party, and we are having great party at the end of the ward of the month.
Oh, so great. So, guys, this is a very important learning and opportunity for you all. See, there are so many subjects, so many clinical postings. Build rapport with teachers, do some makhan baji, and assure at least one party every month so that you get to know at least one party and you are able to go to different
Yeah.
restaurants and hotels at least once a month, if not more. So have that beautiful experience along with learning. So coming back to the
Yes.
surgery part and getting into more details of it. So as a student, if you're starting a surgery clinical posting for the first time in second year, so what are things he should be doing during the 1 month? Like what type of cases he should be seeing or what type of OTs he should be attending? So like that.
See, on the first day, the पहले दिन you will be going, the sir will explain everything that we have OTs, we have to go to NCOTs, and we have to take history. पहले दिन every posting in the second year, actually they ask कि history लेनी आती है, still they will teach you कि no, we take history on the first day. And on the first day, पहले ही दिन, like sir will tell कि we will learn this topics. In our posting, sir have told कि you will be learning the swelling symptoms, ulcer, hernia, hydrocele, amputation, sinus, stoma, this kind of topics throughout the month. And beyond this topic, you will be learning the procedure like hernia procedure, venesection, appendectomy, circumcision, and amputation. These were the procedure which they taught throughout the month. And the other part of the surgery, that the surgical part, the surgical instruments, suture, solution, catheter, drainage, and abdominal incision. These were the topics which were taught throughout the month, and they teach every topic in the detail in accordance.
Okay. So these were all the things. Now coming back to it, so what are things are asked in your surgery board ending exam?
See, I don't know what is the different pattern in any other college, but in our college, the pattern is like you have to have a surgery exam in two different parts. One is that the theory part, like for that we were having the MCQ test, and other was the Viva part. In Viva also we were having two different things. In Viva on the first day, we like on the first part we have to go to the wards early and with the stethoscope, apron, and then measure tape and bring everything, and then we have to write a history of one of the patient from the topic which I have told you in the before. So we have to write a history, then the sir will tell us to elaborate the history. So we have to read whole history in a pattern that was taught to us in the words. And then afterwards, after doing this, we have to go to attend the another viva, and that viva was on instrument, x-ray, and surgical procedures. The sir will ask me the surgical procedure, they will show the instrument and tell us to tell the name and explain what procedure can be done, and then the x-rays.
Okay. Can you please tell us how to prepare for this board ending exam?
Yeah, that's a good question. Actually, for preparation, they will tell you the topics, or if they won't tell you, what you should do, that you should make a note, that not whole notes. I'm not telling about notes. You should make a note on each day of your posting. Like you have to write 1 to 30 days, eliminate the holidays, and then what was taught on first day, second day, third day. Then you will be getting to know that you are taught 5 topics, 6 topics, 7 topics, or whatever topics you have taught. Then there is surgical clinical manual, very big, many books are there to read. You can go with any clinical manual of the posting, and then after getting that, in that clinical manual, you have to get not your topic and try to recall what was taught, which perspective was taught, and just read that and go through it. And yeah, main part in surgery, any ward and is the history taking and the examination. So that two chapter you must read. You don't read any other, that will be fine. You can handle everything without reading that also in the vivas. But the main point in the history taking viva is you have to know that why the history is taken, why each and everything is asked in the history, why ODP is asked, why name is asked, everything. And after getting to that, for the viva of the instrument, you have to go to your own OT in your college and take a picture of the instruments. Then you can go to any of the book or anything and read each instrument which is present in your OT table. They will only ask that instrument which is present in your OT for the instrument. And for X-ray, whenever the lecture of the X-ray is done, just take a picture of all the X-rays and go through that X-rays. Mostly there is only one thorax X-ray, one thoraco-abdominal, one abdominal X-ray, and one pelvis X-ray. And in that also they don't ask great detail, just normal anatomy and what is abnormal in that X-ray. So for these three viva you have to prepare, and for the MCQ viva, you have to focus in the lecture that what they have taught in the lecture. They will only ask the question which they have taught. So if you have attended all the lectures, then you might get 20 out of 20 as well. Though it's not big issue if you have attended the lecture.
Okay. So can you suggest one of at least one of the books of clinical manual of surgery, like or if what which you use?
Uh, yeah. See, many of my friends were using the different book, but mainly we all were using S-DAS for that. S-DAS clinical manual, 15th. Although you can use any edition, but 15th is the latest one. So you can use that one. And this is, I think, good book because it have given the precise content. Although there might be some content more also, but that have given the precise content of history taking and sign and symptoms. So that two chapter, which are more important for your second year perspective, that two chapter
Okay.
are given in good detail and with essential point highlighted. So I think as that is a better book. You can go with anyone though.
Okay,
Yeah.
yeah, I also feel as this is a very good book, and I have also referred to it many times. So, because as I've read that book, I know that certain things are not given in it. Specifically, the instruments part, or what you said, the table viva part, that or maybe
Yeah.
the X-rays part. These all things are not given in the book. So, how to prepare for those topics or those things?
See, to be frank, when I was there, I just downloaded the Marrow's notes of the surgery. I have the Marrow notes of the surgery. I have gone through that, but still I was not able to find some instrument. So you can go with the online. You can Google it out. That surgical instrument PDF. You will find a PDF, and in that you will find the instrument. See, in instrument they are not asking a great detail because you just need to know the instrument and its use. After the use, if the instrument is used in the hernia OT, then the viva will be not on the instrument. The viva will be to hernia. So
Okay,
for the instrument, you need to know the instrument and its use. Just 2 points, nothing more than that for the instrument part. So for instrument, I was going through this books, and for X-rays, there were only 4 X-rays. So I was trying to refer to many books, but then I don't get a good result. So I search out on the YouTube that how to interpret a X-ray in the surgery. So I was
okay.
getting that video as well. But see, everything is good, but in X-rays they won't ask much detail. You just need to know the normal anatomy of that thing, and they will ask that what is this structure. Like in my viva, they were asking like what is that? That was the stomach gas. So that's basic things. In X-ray, they don't ask great detail.
Okay. So a lot of insights you're told like guys you can use YouTube as well. So basically you need to be open-minded. And one more point I would like to highlight that as far as I know you haven't bought Marrow, right? You don't have any subscription of Marrow per se. But still you said
No.
you are using you use notes of Marrow. So probably you might
Yeah.
have downloaded it from somewhere like Telegram or something like that.
Yeah.
So, guys, be flexible, be open minded to resources. Like don't get rigid or stuck at one point. And one more point I would like to highlight here is that when I attended my second year clinical postings, I made notes of the instruments and something like that, which was helpful for me in the third year as well. So, and though because I had made that notes myself and I had written only those points which I felt were important or to be readable or to be remembered for me. So that proved to be the best source for me. So one more thing that you could do is you could make notes while they are teaching you those instruments in your notebook or somewhere because I think that would be the most precise and most appropriate source you will find at the time of your exams. So just summarizing it before we end this session here. So basically, for clinical cases, you need to read from SDAS or any clinical manual book. For MCQs, you just need to attend lectures and make notes or remember from it. Not a much big deal. For instruments and X-rays and all, once again, the lectures are the rescue. And maybe your notes or few sources from here and there like Google Images or YouTube or something like that. So that's how you all can prepare from it. And this was all about the surgery clinical postings in second year MBBS. I hope guys you also try and get that unlimited pizza party in your
Yes.
surgical clinical posting.
Yeah,
Yeah,
I
sir.
want to add one more point, that the thing where when we get real party invitation, that invitation was there on one OT day. There was much complicated OT that they have to do the whole ileostomy and that OT was run almost 4 hours. On that day, we were 7 people in that OT. And on
Oh,
that day also, we all the 7 people were standing from 4 hours, from 3 o'clock to 7 o'clock on that night. On that night, sir was impressed. No, you all guys are with us. So like you have to attend OTs more and the NCOT emergency. There you will get chance to interact, because in lecture there is only one way communication, so you won't get chance. But in OTs and in NCOTs, so that was the point to be at,
Yes.
to get a
So
party, you know.
yes, so your excitement and your energy tells that. Yes, so thank you so much, Him. It was a great session and had a great time with you. Thank you guys for watching this video. Subscribe to my channel and stay tuned for the upcoming videos. This is me, Yash Gandhi, signing off.